Hello, good evening. Thank you so much for joining me today as we discuss the rising cases of kidney failure. Has it bothered you? Has it ever bothered you why the rising cases of kidney failure in the society? One major cause is hypertension. Hypertension is a silent killer. I have made a video on hypertension and I was saying that you can have hypertension that's without knowing for many years, and the next thing you're going to see are the complications. And one of the complications of hypertension is kidney failure. You that is watching this video, when was last time you checked your blood pressure? Is it bothering you that you have not checked your blood pressure? You can have BP, high blood pressure, without knowing. So that is why it is important you go and check your blood pressure, because it's a known risk factor and known cause of kidney failure. Now, as we're going further, in addition to hypertension is another lifestyle which is contributing to this hypertension as well, is adding of salt to our diets. We are not saying that you should not add salt to your diet, but adding to the point that you want to feel the taste is wrong, because the food naturally, all the natural food we are eating, they contain the appropriate amount of salt they're supposed to have. What are the constituents of salt? Sodium chloride and iodine. Do you understand? The food we are eating contain all those food you are eating, they contain sodium and chloride as well as iodine in them. So adding more salt to our food is contributing to hypertension, which will subsequently result in kidney failure. So you must avoid that attitude of adding salt. It's not tasting salt, or there is no salt taste in this meal, in this diet, in this food. You must avoid that, because that can cause you to develop kidney failure. The other ones are diabetes. Diabetes is on the rise because of the kind of life we are living these days. Many people are eating junk food, processed meals, fries and other things with associated sedentary lifestyle. Most people are not involving in exercising, and of course other hereditary factors which some people have in their families. So diabetes is a major risk factor for developing kidney failure. So imagine an individual that has diabetes and at the same time has hypertension. Both of these comorbidities will result and will help the person in developing kidney failure as fast as possible. That is why every individual should at least once in a year go for medical checkup, check your blood glucose level, check your blood pressure, assuming all things are normal, at least once in a year for medical checkup. Do you understand? Then we now go down to drugs. The kind of drugs people are taking these days. For instance, the non-steroidal anti-inflammatory drugs. For taking an example like diclofenac, ibuprofen. People are engaging in taking drugs. Any small pain, ibuprofen. Any small pain, diclofenac. I want to let you know that these drugs can damage your kidney. That is why you should see your doctor whenever you are having anything. If you take this drug few days, let me say maximum of 2-3 days, go and meet your doctor and not continuously take the drug. In some cases, they will have a mixture of different NSAIDs in one, and an individual will take these drugs without knowing that it can result in kidney failure. You must be very careful kind of drug you are taking. That is why you have to involve your doctor. Then, as we're talking about drug, we're also talking about these body creams people are making use of, especially our young people these days. Some of those body creams, they contain mercury and some other substances that can go down into the kidney and destroy the kidney, especially all those lightening creams. As they are letting your skin, they are going down to your kidneys to destroy your kidneys. As we're talking about that, we're talking about people that are also smoking. Some smoke shisha and some other chemicals, other substances they are smoking. Some of these substances, they have the tendency of going down to our kidneys to destroy the kidneys. That is why you must be very careful. As must be very, very careful, because some of these things are very bad. Do you understand what I'm saying? So these are some of the things that you should know about factors that can result in kidney failure, as I tell you other things as well. Please share this video. Share this so that other people can learn from it. Other things like spices, adding on spices. There are different spices people are making use of these days. Some of those spices can help or increase the chances of developing kidney failure. So you must be wary the kind of spices we are adding out in our diet. You must be very, very wary of them. And apart from these ones, you see also have obesity, especially the truncal obesity, those pot belly. In one of my videos, I was talking about the dangerous effect of a pot belly. You can go and watch them. They are on my channel. Do you understand? So, and this obesity, which is associated dyslipidemia, abnormal fats in our systems, they can obstruct the blood vessels that are supplying blood to the kidneys. They can also enter into the kidney and enter into the glomerulus. That is where the filtration is going on in the kidney, and obstruct them. This can contribute to kidney failure. Some people may also have glomerulonephritis, which may result from maybe ordinary sore throat or skin infection, bacterial skin infection. Some of them can also go down into the kidney. That's why I was talking about going for medical checkup at least once in a year. For somebody that is supposedly healthy, once in a year, an adult that is supposedly healthy should go for medical checkup at least once in a year. And when you go for the medical checkup, check your kidneys. Do the test that I told you about, that EUCR, electrolyte, urea, and creatinine. When you do them, that can help to check whether you have started developing kidney failure. So things can be done for you as early as possible. Kindly share this video as you are watching, because these are some of the things that people should know about. Everybody should know about this, because the kidney, the functions of the kidney cannot be overemphasized. Do you understand? Everybody should know about this thing. Thank you so much. Thank you for joining so far. Before I kind of summarize, let me tell you that in some men, they may have a bladder artery obstruction. There are some men, they have a prostate problems, so they cannot be able to pass urine. In these men, amongst these people, kidney failure is on the increase, because when urine is not passing out, it's going to mount pressure on the kidney. Mounting that pressure on the kidneys can result in kidney failure. That is why if you're a man and you're watching this video, or you have an uncle, a dad that is having urinary problem, take the person to the doctor, take the person to the hospital, so the person will see a doctor, you see a specialist, possibly a specialist in that area, so that the urinary problem can be corrected to prevent the person from developing kidney failure. Because if the person develops kidney failure, you are no longer going to be talking only about the urinary problem. You are also talking about the kidney failure the person has developed from the urinary problem. So I want to thank you, and I want to thank all my viewers, all my subscribers, especially my returning viewers. Please, if you have watched this video and you have not subscribed, I want to beg you, subscribe to this YouTube channel. And in as much as you are subscribing, share this video so that other people can learn from it. And then like the video, because the more you like, the more people want to see, more people will see the video. Thank you so much for joining me today. God bless you.